Hi, I'm Luke. I'm one of the osteopaths at West End Osteopathic Clinic. I grew up in Brisbane and moved down to Melbourne to undertake the osteopathic double degree. And after 5 years studying in chilly Melbourne, I moved back to Brisbane for the lifestyle and warm climate. My main approach to treatment is that every person is unique and that education often forms a critical component to treatment. A 6-month-old baby is going to require a very different approach to an office worker who spends 40 hours a week at a desk. And of course, my approach is going to vary a lot person to person. As an osteopath, consultation includes a case history of the presenting condition, an examination of the area and surrounding areas of pain, a diagnosis and hands-on treatment. Many of my patients go home with stretches and other advice to help with the healing process. I think what makes me unique is the compassion and empathy that drove me to become an osteopath. One of the great things about being an osteopath is the wide variety of conditions that I can assist with. A lot of the problems are spinal related, such as low back pain, neck pain and headaches, but I also see a lot of other complaints, such as hip pain, knee pain and ankle injuries. It is especially rewarding when I can help a woman through her pregnancy with a lot of the aches and pains that many see as unavoidable, as well as the recovery after the birth and with the infants if they've suffered any birth traumas. I think people like to see me for a few reasons. One reason is results. Pain relief is often a high priority for my patients. Another reason is for advice and understanding. It can be difficult to understand why an injury has occurred or why it has recurred over the space of months to years. I enjoy having the skills and knowledge to help a patient and explain how to reduce the risk of this happening in the future. One great result is a 45-year-old truck driver who had low back pain, which had been going on for years. He was overweight and had been told until he lost his weight, he wouldn't lose his low back pain. I was able to sit down with him and talk about ways in which he could lose some weight by exercising in ways which were pain-free, and even talked about his diet. He was glad to have someone who looked past his weight and to the person. Over time he lost his back pain, his weight, and now he couldn't be happier. I love using my training and experience to help people feel better. I couldn't imagine doing anything else.